Care for the deaf. Hello, my name is Zoe Collins and I am a dental hygienist. Today, I will present a culturally competent dental care plan for the deaf and hard of hearing patients. Today, I will focus on a scenario of a family of 4. In this presented scenario, both parents are deaf and require a professional interpreter. Deaf or hearing impaired. Deaf or hearing impaired is partial or complete loss of hearing. A deaf person has partial or complete loss of hearing. This can range from mild to profound, and they may use a variety of communication methods. This can include, but is not limited to, sign language, lip reading, or assistive devices like hearing aids. Referring back to my personal experience, we will present this as a clinical case. A new family of 4 presents for their routine dental cleaning. The parents are fully deaf and are not willing to allow their children to interpret. We have no interpreter or virtual assistants available. This raises clinical, ethical, and legal issues that we must address. Key cultural insights. Deaf people can be considered a minority. ASL is its own language. Deaf people often identify as a culture and linguistic minority. ASL is a distinct language, not a manual version of English. Respecting visual communication norms such as eye contact, clear sight lines, and directly addressing your patient builds trust between the provider and your patient. Common barriers in dental care. Barriers include lack of qualified interpreters, provider assumptions that written notes are sufficient, and limited staff training. These barriers reduce preventive care, increase anxiety, and can lead to misunderstanding consent and aftercare. Legal and ethical considerations. According to the National Association of the Deaf, patients have the legal right to access communication in a format that is effective for them, which may include an interpreter rather than family members. According to the American Dental Association, dental professionals should implement communication strategies that support patient understanding and reduce barriers to care. Under the American Disability Act, healthcare providers must ensure effective communication with patients with disabilities. Children should not be used as interpreters due to confidentiality, accuracy, and ethical concerns. Always offer professional interpreting services. This provides safety for your patient and, again, building the trust with the clinician and the patient. Communication strategies at a clinical level. At the clinical level, capture communication preference at intake. When you have a new patient coming into the clinic and you know they are deaf or hearing impaired, ask them what is their preferred method of communication. Pre-book certified interpreters. Test virtual assistants as a backup for communication and always allot extra appointment time. Provide caption videos and plain language printed materials. Communication strategies at a chair side. At the chair side, face the patient. Keep your face visible. Use visual aids and models to ensure understanding. You can confirm this understanding by using the teach back method via your interpreter. Do not shout. Speak at a normal pace and let the interpreter do ASL translation. According to the National Association of the Deaf, dental providers must ensure that communication methods meet the patient's needs to avoid misunderstandings and barriers in care. Workflow: scheduling and interpreter booking. Make a note on the patient chart and prepare ahead of time. Workflow: this entails flagging the patient's chart to let them know that they may be deaf or hearing impaired. Book an interpreter. Confirm 48 hours prior and send reminders as needed. If an interpreter is unavailable, offer virtual assistance or simply reschedule for a better time. Document all communication arrangements within the chart. Reducing implicit bias and building trust. Simply be prepared, maybe even learn basic phrases to build trust. A simple hello or even a thank you in ASL can ensure your patient is comfortable. Training staff in deaf culture and etiquette reduces bias. Hiring ASL fluent staff and showing deaf-friendly materials signals respect. Always avoid baby talk or speaking down or dumb to your patient. Always involve the patient in decision-making and their treatment plan. Clinical interventions to improve outcomes: longer appointments, visual aids, and repeat OHI, or oral home care instructions. Implement longer hygiene visits to allot for plenty of time and no rushing. Implement visual home care kits, captioned and ASL health education materials, and schedule follow-ups with interpreters to reinforce care and adherence. Evaluation and metrics. Ensure your actions are making a difference. Encourage feedback from your patients and the interpreters. Measure interpreter use, patient satisfaction, no-show rates, and treatment adherence. Using these metrics to help refine policies and training. Practical tools and resources. Keep track of the interpreters you use. Make this accessible to everyone within the office. Include an interpreter booking script, chairside checklist, and recommended virtual assistants. Make all these tools easily accessible to everyone in your office to ensure for a smooth transition between providers. References and closing. Utilizing the previous actions can allow for a better experience for clinicians and the patients. Thank you. References include guidance from the National Association of the Deaf and the American Disability Act. Also, the American Dental Association. Supporting deaf and hard of hearing patients in dental care goes beyond basic communication. It reflects a commitment to equity, respect, and patient-centered care. By providing qualified interpreters, using clear and accessible communication methods, and creating an inclusive environment, dental professionals can help patients feel understood, safe, and empowered throughout their visit. When we prioritize effective communication, we build trust, improve oral health outcomes, and ensure every patient receives the quality care they deserve.